or just look at me.
Okay. Good evening, Holly.
So this is, I'm about to take a shower, and I'm going to do some videoing that. But this is the top tips I've found. So this is post-op day 3. Again, I've had a breast lift with implants, a full extended tummy tuck, liposuction of the thighs, the hips, the Brazilian butt lift, the grafting, liposuction to, again, the hips, some of the buttocks, the flanks, the back, the bra line, the axilla, and my upper arms, and some fat grafting to my face. I said the butt lift too. Okay, so that's enough. The top tips I would tell you that have really helped me out. This is post-op day 3. I still have my drain in. So first was clean house. I had someone come in and disinfect my house. They've done a really good job. It's really nice to have, to come home to a nice clean house. We've used air purifier down here. I've been kind of sleeping in this recliner during the day, and at night I've been going to my room. Pillows. Pillows are another huge thing. You can't have enough pillows because you're propped up all kind of ways. Another one, these are in no specific order. This has been really helpful. Oh, that's an air purifier. But this is, it's like it's a foot and leg massager. And, when we have surgery, our risk is blood clots, and we need to get up and move as fast as possible and get up and going after surgery. So I've been sitting in here and doing this calf massages, and that helps. And I'm getting up every 2 hours. I think what's highest on my list though is fluids. They tell you to drink a lot of fluids. I don't know how you can't do with fluids, because all the medicine that I'm taking has made me absolutely cotton mouth 24/7. I'm drinking over a gallon a day, and that helps everything. It's helping me live, basically. That's just keep me from getting constipated. Laxatives, good, bad, and ugly. I'm covering this, but laxatives are a major help with this. I bought Miralax. Everyone kind of likes what they like. I don't like Dulcolax because it causes cramps, and that's the last thing I want. Is cramping, because they sewed my ab muscles together. My doctor did the diastasis repair. He says he does it to most everybody. I've never had a child, but I still had diastasis, probably just from weight gain.
And what is that, Holly?
Diastasis is when you have the separation of the abdominal muscles. If you ever see someone with a six-pack, you can see the six-pack, and there's like a nice little linear line between them. And what happens a lot of times with childbirth, getting pregnant, or weight gain, quick weight gain, or just laxity of the abdominal muscles over time, that the space becomes bigger.
But yours is from childhood obesity.
Mine's from just obesity in general.
Yeah.
Not necessarily childhood, but I was obese until I was about 23. And I gained it really quickly.
22,
times.
yeah.
22, yeah. Anyway, so they just kind of go in there and they do this, they just suture the abs back together. And that's called diastasis repair. So I basically have a corset on with stitches inside. So anyway, you don't want cramping. Dulcolax causes cramping. I've been a nurse for 15 years. Everyone I give it to, it's not fun. And it doesn't work very quickly. They give you lots of bandages. They told me to bring a shower curtain to cover things because I would be leaking from the liposuction. Very true. I was leaking. I have holes all over where the liposuction was, and I leaked on everything. Most of it was the tumescent fluid that they use in the suction, so it was just this pinkish fluid mixed with blood. And
yeah, it's not just blood, it's
some of the fluid that they use. And chucks, so you need lots of crappy sheets that are clean, obviously, but just that you don't mind soiling. And chucks. If you don't know what chucks are, they're like the pee pads that you get for like your dog.
Or old people.
Yeah, they give.
You put them under yourself when you go to bed at night, just to protect the mattress.
Yeah. So just these. I'm gonna take this upstairs because I'm gonna take a shower.
Your pink one's upstairs.
Oh, okay.
I accidentally bought that.
So, this is my mom, guys. She's kind of helping me out because I'm loopy from medication. I'm just about to take a shower, so I'm kind of hopped up. So next thing, the abdominal pads they have are good, but maxi pads are actually better because they're long and they just, I don't know, they work really well for this.
Yeah.
Laser hair removal. I read this on a site from a plastic surgeon who suggested this, and I actually took her advice, and it was a really good tip. Although I can raise my arms a lot better than have read I could because of the breast lift, I still do not want, it doesn't feel very good. And so I did get laser hair removal of my underarms and my legs. I don't
It's
have
amazing.
to shave, so I don't have to worry about that.
No shaving anymore. It's amazing.
I actually got everything else lasered too, but excuse me. Laser hair removal, step stool to get into bed. You kind of have to walk like a caveman at first because it's very hard to sit straight or stand straight up. And so if you have a step stool or something that helps you get into bed, that really helps. Protein shakes are really easy. I don't have a huge appetite, and protein's super important when you're healing. So that's been a godsend. I got some diamondized protein powder, just whatever you like. It's good, high quality protein powder. The other thing that's really good is I have a MAR. It's called a MAR. It's a medication administration record, and I have so many pills right here that I have to take. Some of them are required, some of them are just as needed. Pain medicine, antibiotics, steroids, muscle relaxers, anxiety medicine, vitamins. And so this helps you keep track of it. It's really helpful when you're kind of doped up and you don't know the last time.
It's what nurses use on patients.
Yeah. And then this is my drain output I have to keep track of. It's this right here. It's called a JP drain. That gets taken out like a week after surgery. See, I'm already getting dry mouth.
The drain stays in about 6 days.
And it comes out on my groin, like kind of
Yeah.
on the side of my groin area.
Yeah.
So other top tips, friends are always helpful. They've gotten to see more of me than they ever wanted to, helping me get in the shower and out of the shower. Friends, sleep, and let people help you. I've had a hard time with that. Like, as long as you're grateful, and I've had a hard time trying to do that. I think a lot of people want to be independent.
Golly's very independent, so she wants to do it on her own. But I keep calling her down and saying,
Okay,
you got to
Mom.
sit up. Sorry.
Okay, Mom. Love your parents, love your friends who help you, and let them help you. I am grateful for that. So sleep, you're going to sleep. Let yourself sleep. Don't feel guilty for sleeping. You are in healing mode.
Yeah.
But you do need to get up every 2 to 3 hours. And I'm just doing laps around my little house in here. And I think those are my top tips so far. If I come up with any more fun things, I'll let you know. Having a shower now.